You know, it's a great question. Is how can a person at home know what's true? And I think it's harder and harder and harder for them to tell.
Fake news.
Yes, it was fake news.
Fake news is everywhere.
Do you actually know what the definition of fake news is?
What we're doing right now.
Here's the problem: when you're talking about preventing disease, there's no one size fits all. So if you say meat is bad, that's not necessarily true for everybody genetically.
Eating meat was essentially what made us human.
Put it on record, Durant says Sprite is a health food.
Now what Tim is telling us is by cutting out the carbs, you develop what's called a ketogenic diet. Right? His body runs very differently.
And almond milk and soy milk seem to be okay.
Yeah, some more than, and almond milk's not awesome. Unless it's fortified with calcium, it's not awesome. I prefer this, dairy's better. It's a better option.
If you like drinking almond milk and you buy it from the grocery store, it turns out that you are not only harming the environment, but you're consuming a product that might not even really be healthy for you. So
there's a lot of misinformation in the public space about health and nutrition. And it fosters confusion unnecessarily, because it's not really that confusing. The overwhelming majority of the evidence supports nearly exclusively a plant-based diet.
Distorting the truth to the public has become a science, become an art form these days. You can hire professional organizations to plant doubt in the public's mind and through the media.
Because you do have industries funding research studies from otherwise reputable institutions, published in otherwise reputable journals, and they spend a lot of time also lobbying policymakers.
Senator Baldwin says the act will stop misleading consumers at the grocery store.
Make sure that these imitators don't get away with misleading the consumer and cutting into dairy producers' revenue.
But with that misinformation out there, the average consumer, and many docs too, are just like, well, they don't know what's healthy for us, so just throw our hands up in the air. We don't even know what's right, so then you eat what you want.
The biggest misinformation about health in the mainstream is that, pills and procedures are where it's at. I mean, so for most, we have, for acute conditions, like break a leg, suffer an infection or something, modern medicine is just amazing, right? Thanks to antibiotics and other incredible advances. But when it comes to chronic diseases, we fail miserably as a profession.
I think the biggest misinformation about health in the mainstream today is that there's a pill, quick fix for everything. If you think about it, in 2017, 2/3 of the US population is either overweight or obese. So that's become normal. 2/3 of the US population either has prediabetes or diabetes. That's become normal. 70% of the US population is taking at least one medication for lifestyle-related disease. So that's normal. So we have normalized being unhealthy.
When it comes to, many common cancers, heart disease, type 2 diabetes, hypertension, chronic kidney disease, many of these things, what we have to offer may have little or no benefit, or even anti-benefit, right? We kill 106,000 Americans every year through, adverse drug reactions, basically, from side effects from prescription drugs.
Elderly dementia patients taking Abilify have an increased risk of death or stroke.
Severe liver problems, some fatal, were reported.
In some cases, extreme high blood sugar can lead to coma or death.
So, doctors are in effect, just from that stat alone, the sixth leading killer in the U.S., right, is the medical profession.
What do you think is the biggest misconception about a vegan diet?
The biggest misconception is everyone says, where do you get your protein?
Without a doubt, the biggest misinformation that people have is they ask me where do they get their protein, and don't they need to eat and consume dairy products for calcium? And both of those are myths. We don't need to do either.
I grew up thinking that we had to eat animal products. I grew up as a typical proteinaholic.
This fear of not getting enough protein is totally unfounded. How many people do you know have an actually diagnosed protein deficiency?
Eggs have been marketed to be the perfect protein.
Having studied nutrition now for over 10 years, having gotten a PhD in nutrition, I'm firmly convinced that animal protein is not necessary.
There's no mandate to eat eggs at all.
There's a big marketing effort to
make people believe that eggs are crucial to health, and in fact they're not.
This is 1981. People are saying, where are you going to get your protein, and you're going to starve to death. I saw that there were plant-based athletes there. I had Bill Pearl and these massive bodybuilders and endurance runners and swimmers, so I knew it could be done. And I knew the biggest animals on the planet were elephants and buffaloes and giraffes. They made thousands of pounds of muscle on plant-based materials anyway, so I knew they could do it. So the biochemistry is there, the physiology is there. You can run a mammalian body on all plant materials.
Well, the biggest misunderstandings are about fish.
Fish is not essential. It has never been essential. Mercury is not essential in the diet.
The oily fishes like salmon and mackerel and herring, which are high in omega-3s, they concentrate it. The ultimate source is marine phytoplankton and algae. They're plants.
The Okinawan diet, people think it's a fish-based diet. It's mostly calories from sweet potatoes. Not only do carbohydrates not make us fat, starch doesn't make us fat. People are afraid to eat potatoes.
The fear of carbohydrates. That's the ketogenic world is very popular right now. And you have this book, The Plant Paradox, going around. It's just crazy that people are afraid to eat a banana, a potato, beans. To think that these foods are unhealthy, to me, is just mind-boggling. It's crazy.
People like good news about their bad habits.
Toss out that nutritional food guideline and eat more fat. It's good for you.
More delicious fat. I like this story.
And people like the artificial stimulation of dopamine in the brain that comes from hyperconcentrated foods. So it's very difficult for people to give up their desires.
There is a big misconception out there that carbohydrates make us fat, and nothing could be further from the truth.
When the body is trying to convert carbohydrates into fats, about 1/4 of the energy is lost during the metabolizing process. So it's much harder to get fat out of carbohydrates compared to fats.
Beans are carbohydrate, grains are carbohydrate, rice, oats, barley, strawberries are carbohydrate. And if you think broccoli, if you think these are the foods that are making us fat, you're really not paying attention.
So what's your nutrition return on investment for 100 calories of egg besides protein? How much fiber is in 100 calories of eggs? 0. How much vitamin C? 0. How much cancer-fighting antioxidants, polyphenols? 0. So if you decided to invest that 100 calories in broccoli, right? 100 calories of broccoli has almost 7 grams of protein. And what else does it have? A ton of fiber. It has antioxidants and vitamin C and vitamin E. So which one's going to be your higher return on investment?
A lot of you guys have probably heard of the documentary What the Health? What the Health?
This What the Health movie.
Isn't that incredible?
Driving the world crazy. Everyone's vegan now.
And you look pretty fit. What diet are you on? You on this? Plant-based. You're on a plant-based diet?
Yes. My fiance watched this documentary called What the Health.
Okay.
And now we're vegans.
What?
We grow up with this belief that you need to eat animal foods, and that's being clearly debunked. And that, I think, is one of the most important things that's happening right now.
There's plenty of athletes all over the planet now going vegan for their health, to improve their skills, and they're seeing themselves go up in the rankings. And for me, the experience of it, I felt so much better within days. I felt a difference in me as an athlete. It was a test and it was a challenge because I thought maybe I will get worse. I didn't really know. I thought the protein myth and all this stuff.
So now in the case of almond milk, they're like, oh, that's better for you. I'm like, no, it's not. First of all, it's not really almonds. No one believes that. Second of all, it's not better for you because it's not real milk. Not buying any of this nonsense.
Yeah, calling it milk is interesting.
You should definitely drink milk if you are a calf who is not able to eat on his or her own. Cow's milk is what nature designed for you. And if you are a human being, you should definitely drink milk from your mother while she is breastfeeding you. But one of the rules that nature laid down for every mammalian species is that you got to get weaned at some point. And human beings being so creative, we figured out that we don't ever have to get weaned if we invent a dairy industry.
So I just tried taking dairy out, and it started to help my acne, started clearing it up. And then I thought, if I can make one little tiny dietary change, why not try some other things? So I started what I call mega dosing vegetables, and I was taking 12 to 16 vegetables a day.
The biggest misinformation about health in the mainstream, I think there's a few things. I think in the media we get We hear a lot of hype around trendy fad diets that are absolutely not evidence-based. They are harmful, potentially deadly to people. So I think that to me is a crisis, just the media coverage of nutrition.
The paleo diet, Whole30, and the blood type diet. And you can't believe what there is to talk about. I mean, do you know they have caveman cookies?
One of the biggest misconceptions in the mainstream news media now is this whole low-carb, ketogenic, high-fat movement.
Also, there's something we call the sniff test, which is if something just doesn't smell true. Like, you can eat all the sausage you want and it won't cause colon cancer, and eggs don't cause your cholesterol level to rise. I mean, those things really don't pass the sniff test very well.
And caveman cooked cake mix. Now, you know our ancestors sitting around the campfire were using cake mix, right?
When someone's saying eat as much butter, steak, fried chicken as you want because it's filled with fat and low in carbs, then that's news that people want to hear. And unfortunately, the media is going crazy with it. So I think that is doing a huge injustice to the health of not just our nation, but our world. And you know, we have our work cut out for us in the whole food plant-based movement. It's one of the reasons that I truly believe in my heart of hearts that I'm 40 right now, but you know, God willing, when 40 years from now, when I'm 80, I'm still going to be doing this. That's how big of an issue this is. That's how much work there is to be done, and that's how sick we are as a world.
There is not a single more study that needs to be done that can fully convince the world that a plant-based diet is actually the best option for long-term health. It's a question of trying to convince people how to adopt that mindset.
And more people are aware that eating animals is not necessary for survival or for health. In fact, it's, you know, quite likely counterproductive.
And the power of those foods to reverse chronic illnesses that probably drive 60-70% of all the healthcare money we spend in America, only you control that.
You know, like with heart disease, #1 killer here in the States, there's only one diet ever been proven to reverse heart disease in the majority of patients, right?
What we found is that heart disease and diabetes were so changed by this diet that you know, the evidence was overwhelming.
It's the power of food. And then in 3 months, I'd lost 50 pounds, and to this day, those 50 pounds have stayed off, and I eat like a horse, eat a bunch of food, but it's all whole food, plant-based.
I've never seen anything come close to the breadth and depth of benefits that a plant-based diet provides.
With your blood sugar, diabetes, we know that it helps you lose weight.
Right.
We know you'll live longer. So now that you know all that, are you going to try it or not?
We're literally on the cusp of what could truly be a seismic revolution in health. And this seismic revolution is never going to come about from the invention of another pill or a drug or a procedure.
I have to tell you something. If I hear one more time, we don't have enough research and we don't have enough data, my head is going to explode, seriously. And here's why I say that. The first thing is we have an enormous amount of data that's largely ignored. One is population studies. You know, fortunately, there still are some places on the planet where people enjoy better health. You know, the heart disease and cancer rate in Uganda, still very low. Okinawa, still very low. These people eat differently than we do. And so I guess I'm getting a little bit tired of my colleagues using their laziness as an excuse for not moving forward with something, because if you take the time to look into this, back to that curiosity gene I mentioned earlier, you'll find an enormous amount of data to support the use of diet for almost every chronic degenerative condition.
This seismic revolution will come about when we have the will and the grit and the determination to share with the public what is the lifestyle, and most specifically, what is the nutritional literacy that will empower them as the locus of control to vanquish chronic illness.